Okay, so part 3 of our refresher, we've covered, ambulance safety. That was about half an hour. We've covered lifting and health as far as personal health goes. And so now we're on to part 3. Our kind of EMS hygiene, EMS hygiene safety, PPE, those sorts of things. Now, we're a year into COVID-19, 13 months into it. And this is not a discussion on the politics of it. This is not a discussion on whether it's a made up thing or whether it's, anyway, it's none of that. This is strictly based on protecting ourselves and our patients. And this is nothing new. They've been preaching this to us for, well, basically since the Civil War, when we started finding out that people were dying of infections that were being spread because of cleanliness issues. So BSI, body substance isolation, PPE, personal protective equipment, whatever you want to call it, okay? One of the things that we've learned in the last 13 months is how to wash our hands again. If you think about it, we never washed our hands. We went from patient to patient. Well, I had gloves on. We went to Walmart. We went to Publix or Hannaford's or whatever your shopping center is, and you came out to the truck and you started stuffing some of the food into your face. Never washed your hands. How many of you had a thing of alcohol cleaner in the front of your car before this? Very few. Now I have one in each of my trucks. I have not quite a OCD approach to it at this point, but I use alcohol cleaner a lot now, and I wash my hands with soap and water a lot now, and I'm a lot more cognizant of it. So this is right out of, I think, again, it was a Brady book. When do you wash your hands? Before and after patient contact. One of the things that some of the physicians I know over the years used to do a lot was they would walk in, and as they started talking to a patient, they'd wash their hands. Or they would hit the alcohol can on the wall, wash their hands while they were talking to the patient. And then they did the same thing as they finished up. And I always thought that was kind of a little overkill, but now that I look back on it, it made the patients realize that they took this seriously, and it made them feel more comfortable with what was going on, as well as the fact that it was truly effective. So now I try to do that myself. Before you eat, after cleaning equipment. It actually said after you use the toilet, you should wash your hands. Blowing your nose, coughing, sneezing, scratching your butt, whatever it is, wash your hands, okay? The alcohol-based cleaners, whether it be the gels or foams or whatever, excuse me, are very good because you can have them any place. It's hard to have a sink in your car. It's hard to have a sink in your ambulance, but these alcohol cleaners are good. But if you read the fine print on the can or bottle, what it says is if your hands are grossly contaminated with blood or body fluids, you need to wash them with soap and water first. Because while this will kill germs, it can be overwhelmed by frank blood, okay? So wash your hands with soap and water when you can, 20 to 30 seconds, right? Happy birthday to me, whatever you want to do. Get under your nails. Don't wear rings to work if you can avoid it. Because very rarely do we take these rings off, and they're just a haven for bacteria, besides the fact that you can rip, deglove your finger with a ring. But false nails, fake nails, a lot of hospitals now have policies you cannot have fake nails because you can't clean under them. There's little air pockets where the adhesive isn't all the way, sealed. And so you're carrying germs back and forth. I'm not telling you not to get fake nails, but just that's something to think about. Gloves. when I started EMS, we weren't wearing gloves. HIV in the mid to late 80s is what really brought the need for gloves to a forefront. So I had to relearn how to start IVs because it feels different wearing a glove than it does without. Wear your gloves and take your gloves off after you do patient care. You don't need to walk into the house with your gloves on. To me, PPE is PPE, whether it's dating or whether it's an EMS. And I tell my students this, and I told my kids this. If you're going to, don't play in somebody else's, body fluids. If it's wet and icky and it's not yours, don't play in it. But if you're going to, wear your PPE, okay? So you walk in, and I know the last 13 months we've kind of stopped shaking hands, which is a shame, because if you shake somebody's hand, wash your hands afterwards. You can still shake somebody's hand, just don't put your fingers in your mouth after. Don't rub your eyes afterwards. Don't pick your nose. Okay, shake a hand. Hey, how you doing? I'm Kevin. And then wash your hands, right? You walk into a house, whatever. Okay, you walk into an exam room in the hospital. Hey, how you doing? I'm Kevin, one of the medics. Shake their hand, walk over, wash your hands. Okay, you're gonna do something where there's wet, nicky stuff. Put your gloves on. Do not put your gloves on, touch wet, icky things, and then get in the front of the truck and drive the truck with your gloves on. It happens all the time. Okay. Goggles. I know a lot of hospitals right now, it's mandatory. If you're around a patient, you have to wear goggles, period. Safety glasses, whatever. Reading glasses don't cut it because there's a lot of room around them. So I bought a pair of safety glasses that have cheaters built into them because without my 1.5 cheaters, I'm not doing anything within 2 arm lengths of my body. So plan ahead for that. Now, masks. We're all sick of masks. And you'd think after 13 months, I would remember to grab a mask when I get out of my truck to go into Walmart. But I get about halfway across the parking lot and go, ah, crap, and walk back and get my new mask. Surgical masks protect us from each other. But the N95s obviously do a better job of protecting us from somebody else's droplets. I read the fine print on a box of these N95s once, and what it said was, these are for the person, these are for the caregiver, okay? These are not for the patient. If the patient has TB and is coughing and sneezing, the surgical mask will protect other people around them better than an N95. A lot of the N95s have exhalation valves on them, like the one on the bottom right that the guy's wearing. So you're wearing your surgical mask and you put the fancy N95 on them because it's better, you're going to get TB or COVID or whatever, okay, if you're within that 6 feet of them. All right, so the N95s go on us, and the surgical masks go on our patients. I have started about 3 or 4 months ago, I started wearing an N95 for all patient care, not just the ones that are questionable. If I'm going to be within 6 feet of somebody for that 5, 10, 15, 20 minutes of whether it's just doing an assessment or whether it's walking into a room to start an IV for somebody, whatever it is, I put an N95 on now because, my son and daughter-in-law have a brand new baby and my little grandson, and I want to be able to see him. And I knew I had to take some precaution, excuse me, in order to make them feel safe, excuse me, to be able to visit. So I started wearing an N95. I also have a risk factor, with my diaphragm having a little bit of damage from a surgery. So I'm at a little bit of a respiratory risk. Oh, man. So I started wearing an N95, and they suck, and they're hot and whatnot. But wear your mask. Anyways, gowns. The little blue plastic gowns that are about 50 cents a piece. They're nice. They're small. They fit in a cargo pocket. Recommend them. We now know, oh, well, we're going to put a COVID patient in our ambulance. We have to put on N95s, goggles, and a gown and gloves. It's the ones we don't know about that are going to make us sick. They're the ones that we're wearing just our mask, or we put them in our ambulance without a mask on. I go on call after call after call, and my 911 calls right now have first responders typically before I get there. And they're standing around 5 people in the house and nobody's got masks on except first responders. So I now carry in one cargo pocket, I carry about 15 surgical masks, and I start handing masks out. I'd say, hey, do you guys have masks? Can you put them on, please? Before I walk in the house. And if my patient, I'll put a new mask on them because I'm going to be next to them for a while. But I'll hand out masks if I have to. My other pocket, I have a blue disposable gown. And I started doing this about 12 or 15 years ago, so that, you know, if I'm on the way to a call and PD talks about somebody with a lacerated whatever, I can put my gown on and protect my clothing, which protects my family. Okay, so gowns, good idea to have those as well. Now, CDC says that all public health systems should have an infectious disease prevention program. And part of this is that it needs to be in writing. I want you to think about 2 a.m. going on a call, having an exposure, whatever it is, COVID, blood products, feces, whatever it is, and getting to the hospital and going, oh, what should I do? And they go, well, we don't know what your policy is. And you call your supervisor or your boss or your fire chief, who you wake them up. They don't even know you went on a call. And they're like, I don't know, we'll deal with it in the morning. So you go back to the station wearing your nasty clothes, okay? You contaminate yourself, you contaminate your truck, you contaminate your cruise quarters, your bedroom at the cruise quarters, and then you take the clothing home and wash them in your washing machine, and you contaminate your 2-year-old daughter's clothing, okay? 160 degrees is the recommended temperature before COVID, you know, just for bloodborne products, bloodborne pathogens. Our hot water heaters are set between 120 and 125. They're not going to kill it. Also, we should have preventative vaccines. Don't be an anti-vaxxer, okay? Hep A, Hep B, Hep A, fecal oral. Well, I don't need that. I mean, I'm not putting poop in my mouth. Are you or aren't you? You touch the countertop at somebody's house. You touch a countertop at a restaurant, and somebody has wiped their ass, not washed their hands, and then handled your food, or wiped their ass, not wash their hands, and touch that countertop. Hepatitis can live 2 to 3 weeks on the surface. So now you take that food, you've touched the countertop, you take your food, or you scratch your mouth, you pick something out of your teeth, you whatever, pick your nose, you've got Hep A. Okay, Hep B, bloodborne. Flu shots, so we'll talk about that in a minute. Measles, mumps, rubella, varicella, which is chicken pox, and pneumonias and pertussis. So pertussis is whooping cough. Over the last 10 years, we've seen outbreaks every winter of pertussis, except this year. I've not read anything about a pertussis breakout in New England this year. Pertussis, whooping cough, is a respiratory airborne disease. Strep throat. We've seen more strep throat, or not more strep throat, but we've seen stronger strep throats. We've seen less flu. We've seen no outbreaks that I'm aware of pertussis this winter. Masks. So masks prevent pertussis. Masks prevent influenza. But you use the same nasty, dirty mask every day for a month. And you're exhaling your strep into it, and you're inhaling it again and again. And so there's some thought process that some of these stronger streps are because of dirty masks. So masks work, but make sure they're clean masks. Now, if you don't know your status on this, then you can get titers, and they recommend you have titers. Most of the hospitals that you go to work for nowadays, you have to have titers drawn. And if you can't prove that you had an MMR, well, you gotta have a titer. So in 2008, I went to work for Exeter Hospital, and they drew titers, and they said, one of your M's and your MMR is no longer effective. We'd like to revaccinate you. I was like, yeah, okay, it's been 25 years, whatever, go for it. But at that point, my Hep B vaccine, which was 20 years old, I was still immune. So it made me feel good. It made me feel safer. So get some titers done. If you're going to be an EMS student or nursing student in the near future, you're going to have titers done for the same reason. PPD, right now, your TB tests, a lot of times they recommend that you have them as a starting point for a new employee, and you have to have it as a starting point for a student. Otherwise, unless you work in a high-risk environment, jails, homeless shelters, etc., some high-risk areas, you don't need yearly testing unless you're exposed. Now, 1918 influenza, the Spanish flu. So CDC journal in January of 2006 called this a mother of all pandemics. And it's still the mother of all pandemics. United States, I think our numbers as of last week were 500,000 deaths from COVID-19, which is awful, absolutely awful. We're at what, 375, 380 million people, whatever it is. We're still at, so that's somewhere around 2% mortality rate for COVID-19. Influenza of 1918 killed somewhere around 100 to 150 million worldwide, and our population numbers were significantly lower. Now, 2018, I went to the Naval Aviation Museum, which is at Pensacola Naval Air Station. And it's a phenomenal place if you happen to be looking for something to do around Pensacola. You walk in and it's different eras have different sections of this museum. So this was in the World War I area, and it was literally a wall, and it was all about the Spanish flu. So next to their World War I Jennies and their little sandbagged areas that represented an airfield in France, they had the Spanish flu. So it was that big of a deal. There were at least 2 waves. I've read recently there might have been a 3rd wave. Started in Spain, spread into Europe as the troops came home. So World War I ended on what is now called Veterans Day, November 11th, 1918. And over the next couple of months, those millions of troops that were bogged down in the mud fields of Europe all went home. And so you can see the first wave in yellow went back to the United States and proceeded across the United States. And think about 1918, 1919. They came home on boats. It might take a couple of weeks to cross the Atlantic. And then they went by train across the United States back to wherever they started from. And so when you compare that spread of that disease then with our current ability to move around the world at a minute's notice, over 24 hours you can be any place in the world, you can see why things like COVID spread so quickly. So we had troops going back to Africa. There were a lot of colonies in Africa at the time that were British and French and German, as well as in Southeast Asia, Australia, and whatnot. So they went out, and then a second wave hit and came back across the world again. Now, they estimate that about 1/3 of the world's population were infected and had clinically apparent illnesses during this. Total deaths were at least 50 million, and they argue could have been as high as 100 million. Remember, in 1918, we did not have the ability to track as well and to communicate as well with everything that's going on. We certainly didn't have the internet and 24-hour news sources at the time. So 75 years later, they were asking, why was it so fatal? Were there 3 waves? What was the animal host? Why did it kill so many healthy young adults? Now, with COVID-19, we know that the majority of the fatalities are older and or with comorbidities. So in the state of New Hampshire, for example, I don't know exactly how much, but 95%, by my recollection, were patients over the age of 60 years old. Yes, there are some young folks who have had horrific experiences with COVID. And I would say that it's probably medical care that kept so many young people alive with COVID. You know, in 1918, we didn't have the hospital care that we do now. We didn't have the IV hydration. We didn't have antivirals. We didn't have the ability to clean things in between patients. We didn't have hospital care. You know, most patient care at this point was still done at home. So in 2006, they said, could this similar pandemic again? And if so, what could we do about it? So they figured in 2006 that even with modern antiviral and antibacterial drugs and vaccines and prevention knowledge, that an equivalent virus would kill at least 100 million people worldwide. I think we've certainly done better with COVID-19 than 100 million, thank God. It's still not over yet, though. Okay. There were some potential pathogens that they thought could cause even more than 100 million. Now, in 2007, we had this thing called SARS that started, I believe, in it was Singapore, and or 2007 was this article based on 2003 SARS. Severe acute respiratory syndrome spread to 29 countries and had a 10% mortality rate. COVID's 2% roughly, at least in the US. Now, there were no drugs that could stop it. There was one super spreader, and we know what super spreaders are now. We have super spreader events, but we have super spreader. One of them infected 143 people alone, including every one of the 50 doctors or nurses who took care of him. That scares me. So how did they stop SARS? It was not medicine, it was not vaccines. It was old school isolation. They tracked patients, they isolated them, quarantined them, right? We all bitch about, oh, 2-week quarantine right now. I gotta work. I gotta go to my friend's house. I'm going to Thanksgiving. Well, that's a super spreader thing, okay? So this is how they slowed it up and stopped it. They had one person who got on an airplane, I believe it was in Singapore, got off in Toronto and infected everybody on the plane. In the time since 2003, these aircraft ventilation systems have become extremely efficient. I fly Allegiant a lot. I have no affiliation with Allegiant, mind you, other than they fly out of Portsmouth, right down the road from my house. And their aircraft recirculate outside air every 3 minutes. The entire air system is recirculated with fresh air. So, you know, they say that the aircraft systems are significantly safer than anything you could find anyplace else. So it's safe to fly again. I mean, you want to wear a mask, but, you know, 2003, things were a little different then. I was part of a committee at the hospital I worked for in Rochester where they had members of each area within the hospital, you know, paramedics, nursing, the ERs, the med-surg floors, maintenance, housekeeping, etc., on a committee and trying to figure out how we were going to handle this anticipated influx. We anticipated numbers like New York City saw last February and March. And the thing that stuck in my mind was the hospital had a medical office building attached to the backside of it. And we were trying to figure out which office was the furthest one away with the most space that we could use to store all the bodies. And then what were we going to do with them? Because it was summer, you know, I mean, what are we going to do with all these stinking bodies and decomposing bodies? So in New York City, they brought, you know, trucks in. Unfortunately, they weren't all refrigerated. And there were some trucks that were discovered by authorities because they were full of decomposing ugly stuff. So influenza and COVID, right? virus person to person, large respiratory droplets, but contact also. Incubation is 1 to 4 days. So one of the hospitals I worked for, I did a lot of COVID testing, and we would have people come in who got exposed 2 days ago. I got a call this morning. My friend or my date or whatever it was just called me, and they became sick last night. They got tested this morning, and they're COVID positive. So I need to be tested. Okay, when did you have your exposure? 2 days ago. You're not going to pop positive even if you have it. It takes 4 to 5 days. Okay, so these people were getting negative tests, and they were going about their regular life and becoming symptomatic in 4 to 5 days and spreading it between then and the time they got quarantined. So kids can be sick and positive several days before and 10 or more after. And if you're immunocompromised, you can be sick for weeks or months afterwards. And we're seeing that with our comorbidities with COVID. Now, the influenza vaccine is about 60% effective, which goes with the fact that it's a trivalent vaccine, 3 most likely strains. 2 years ago, CDC said, we screwed up. We were only accurate with 1 of them. So 33% effectiveness. I'll take that. I get the flu vaccine every year. I have not had the flu since I started getting the flu vaccine back in, I don't know, the 90s. So I know that you can get the flu and you can get very, very sick, and the flu kills people. We have seen very little flu this year because, we're wearing masks and we're washing our hands better. But the vaccines are important. All right, so recap of that. Wash your hands, wear the appropriate PPE, whether you like it or not. Get the vaccines, whether you like it or not. They're not they're not putting microchips into your arm. They're not, all this crap. They're not tracking you. Don't be a conspiracy theorist. Do this for your families. Do it for your patients. Do it for yourself last but not least, okay? And, if you want to travel, you're going to have the COVID vaccine. My wife's work hospital had a long-standing rule for most of COVID where you couldn't travel even for essential travel unless it was for work. You could not travel outside of New England. And if you had a family member who traveled, then you had to stay home in quarantine for 2 weeks. They were super anal about it. And now they've changed theirs to, if you've had the COVID vaccine, it's been more than 2 weeks, you can travel for any reason you want. And I think that's good because the COVID vaccines right now, the Pfizer and the Moderna, are 94 or 95% effective after 2 weeks, after your second shot. So you're not going to bring it home and give it to your family members, right? So get the vaccines, protect yourself, protect your families. All right, so that's the end of part 3. We'll go to part 4.